any other question you might have in that area or otherwise that has to deal with a woman's reproductive system. By the way, Dr. Karen, who do men go to? They still come to a gyna?
It depends on the problem.
Okay.
They can, if it's something reproductive health, we can see.
Okay.
If there's any surgery that needs to be done to them, it goes to urologists.
Okay.
Yeah, surgeons, any surgeon.
Okay.
Yes.
All right. There you go. Answered. Okay. Just before we get to the questions that have come in, allow me to make this great announcement that we have you have a chance to win 500,000 Kenya shillings. I'm talking about 500,000 bob. In this economy, who doesn't want 500,000? If you are 18 to 24, Dr.
Where are some of us missing from that age group?
Okay. So if you're 18 to 24, then this is a chance for you to showcase your talent and stand a chance to win. We're calling this the RAF. The auditions in Mombasa will be taking place next Thursday, the 13th of October, and we are inviting anyone who feels like they are talented in any way to register for this. This is what you do. You send us an SMS starting with hashtag the RAF with your name, your county, and the talent that you would want to showcase on the number 22232. That is 22232, and you will get an invite to auditions that will be happening near you. Of course, after Mombasa, we're coming to Nairobi. Hooray! We have been waiting for this, and it's it's about to go down. You can call us for more information on 0709 861 223. That is 0709 861 223. Please remember to carry a copy of your national ID to the venue of the auditions. This is a RAF, identifying talent and inspiring passion. All right. So, Dr. Karen, we start off with someone who asks about okay, they're asking what is, I hope I'll be able to read this name. So what is myoma and adenomyosis?
Okay. So
do they make sense?
Yes, they do. Okay. They do. Myoma, these are other names for fibroids. Okay. There's myoma, there's leiomyoma, there's some people who write fibroma. Any of those is just a fibroid. It's just a fibroid, non-cancerous, yeah? But adenomyoma, when we are talking about if this is adenomyosis, if that's the mention the person is saying, that's something. Okay, this is there's endometriosis and adenomyosis. Okay. Endometriosis is the one that has the tissues inside the uterus. The endometrium goes to any part of the body, and it's not supposed to be there. But now, when that tissue goes into the muscles of the uterus, now it forms what is called adenomyoma. So it is inside. It's not a fibroid, but it is now clusters of endometriosis inside those layers in the muscles of the uterus. Okay. Yes. So that is what we call that. It's also devastating. It's the same thing that happens in endometriosis. If there's bleeding, that bleeding occurs inside the muscles of the uterus. Can you imagine the amount of pain this patient is going through? So that's different from a fibroid.
Okay, fine.
But there are people who can get both at the same time. Oh. Yeah, unfortunately. And then around 1% of everybody who has a fibroid, only very, very few people, but very rare, they can develop an adenocarcinoma. Now that's a cancer. Cancerous. Yes, instead of the fibroid, it's a cancer. Okay. But that's why we encourage people to have follow-up and have their first ultrasound. That is me, coming from me. Yeah. Just do your first ultrasound when you're 25. If you've never done, just do your first one. If it's okay, do your regular gynae checks. Okay. If there's a fibroid and it's small, it needs follow-up. If it's a fibroid that doesn't have symptoms, there's ways we manage it. If it's a fibroid now plus symptoms that you've been experiencing but didn't think that it was fibroid, then we can also manage it in different ways. Okay. Yes.
All right. Should a coil stay for 10 years? Are there any effects of it remaining inside after the 10 years? This is someone who says, I am in the menopausal stage.
Oh, perfect. Thank God, because last week we were talking about contraception.
Yeah.
And a coil, if it is the copper coil, copper intrauterine device, IUD, that one can last up to 10 years. There's an allowance up to 12 years, and that's okay. Make sure you have good follow-up. There's that other one that has hormone and it has progesterone. It reduces bleeding. It's good for people who have heavy menses. It helps reduce that kind of bleeding and can last up to 5 years. There's some that have been allowed up to 6 years. Yeah, so if you're menopausal, then you have a coil. It's good to just keep the coil and finish your number of years with it, and then get it removed. Don't forget to don't keep it inside, because this is a foreign object. You don't want to keep it more than the expiry date of you having it, even if you're in menopause. Yeah, but I would advise that because you've just gone into menopause, or you're in between menopause, or you're transitioning, just keep it, because there are people who can ovulate when you don't know or when you don't expect, because the body is just doing its last few eggs and removing them. You might get pregnant. It's still very possible. So let her finish her 10 to 12 years. Yeah.
All right. A question to Dr. Ari. I think you've answered this, but anyway, are fibroids cancerous, or do they advance to be cancerous? What lifestyle do we need to adopt to prevent them?
Yes, so it's a very, very informed question. Fibroids can convert into cancer, but only in very rare cases. It's very rare to get that fibroid will convert, but we have that 1% of the whole population in the world. Remember, in the world, that they can develop what we call a cancer that could have converted from a fibroid. There are many changes any fibroid can take. It can change in different ways, but the cancer is the one that we would be very worried about, but not really worried, because we can be able to catch it if we remove the fibroid early enough. Yes. So what was the other question?
What lifestyle do we need to adopt to prevent them?
The same things. We always talk about diet, keeping your body happy. Remember, happy, keep your body happy, because it's good medicine. It's even in the Bible. Getting your body active. Get your body active. Make sure to eat less estrogenic foods. You can cut on your milk, especially the one that's directly from the cow, because it has estrogen. It's coming from the cow, the soya, the red meats, all that. And I think also from my research that also a lot of these animal products contain estrogen. So you might want to reduce on that and eat more vegetables, fresh fruits, and all that.
All right. Now, this one says, my question is, I usually have very painful periods, especially on the first 2 days. Painkillers don't help sometimes, and I haven't sought any medical help so far. Is there something to worry about? What can I do?
Painful periods is something that most women will experience. At least around 60% will experience pain at any one point of their period. It could be the first day or the second day, but the amount of pain is what that can categorize you as you need to see a doctor or not. So if it is the kidogo cramping during that time, it's possible, because you're compressing the muscles of the uterus and they're not getting good blood supply. When there's a bit of a contraction, there's some chemicals that are released that can cause pain, and that's okay. It should be mild. But when we move from moderate to severe, if we put a scale of 0 to 10, if yours is now above 5, you're like, this is more than 5, more than what I can handle, then to be good to get checked, because most of you will be fine. But because of those chemicals that are released in your body, you will experience some pain that can be managed by simple painkillers. At least, even if you exercise and you can keep yourself busy, your mind off the pain, it can go away. For most people, if you keep yourself active and exercise during this time, it might reduce the pain. But if you can't, you can use simple painkillers. But now when it comes right to reduce your amount of work and what you're doing at home, you cannot go to work, you have to take breaks from school or from wherever it is, you need then to see a doctor, because it can be anything. Yeah.
All right. This one says, I was found to have fibroids, a big one, and she writes that in caps, a big one, that last 2 months ago. I am 38 years old. I don't have a child yet, and I haven't decided to have them removed surgically. I have decided actually to have them removed surgically in a month. Any advice from Daktari?
Oh, that's a good question, because not very many people have gone through surgery. Maybe it's your first time to go through any surgery. The thought of any surgery, the thought of being under anesthesia, trust me, even as doctors we experience, if you have to go for surgery, you are always having that a bit of anxiety and worry about going for surgery. But if that is the best method for you, especially now that you want to conceive, and you're 38, it would be, even I would say, let's go and do this surgery so that you can be able to get rid of this fibroid, so that you can conceive and maintain your pregnancy before a certain age. Because from 40 and above, the chances of conceiving kind of reduce as compared to if you were in your early, let's say 30s, 31, 32, 33. So removing the fibroid will take, probably, if it's a big one, most likely you'll have an open surgery if it's as bigger than a certain size. So open surgery is you get under anesthesia. You don't feel anything when it's being done. Afterwards, there'll be a scar. That is the problem with most ladies. There'll be a bit of pain the first couple of the first week to the second week, but after that it gets better. So I will not say that there will be no pain at all. There's some little to moderate pain because you're on painkillers, but after that you should be fine, and then you'll be given, with follow-up, you can decide when to conceive. But know that even after this, there will be a likelihood of having a cesarean section. Not likelihood, if it's big, it's going to be a cesarean section.
Okay. And still on that, someone asked, Doctor, is there a tablet that one can swallow to just shrink the fibroids so that to avoid surgery?
There is no one tablet. This thing is multifactorial. Even if you take the tablet and it gets things away, which there isn't, the system is still the same. The feeding, the people, the genetics, whatever is around you. So it doesn't completely... if there was a drug we would give once, we would not be talking about fibroids like this. But there are ways, the same things I was saying, other ways before we can do surgery to try and treat this fibroid, especially if they're small. But if they're big and they're symptomatic, or they're small and they're symptomatic, even if we give you injection to reduce it, the chances of going to surgery, it's just delayed.
Okay. All right. And I think that also answers Daisy on Mombasa Road. You say, thank you for this education. Thank you for bringing Daktari on board. My question is, apart from removal of the uterus, what is the other treatments for the uterus? No, she says for uterus fibrosis. Is this the same thing we're talking about?
Fibrosis is scarring.
Okay.
That's a little but I think if they're talking about fibroids, it's the same treatment will be the things we've talked about. But if we're talking about fibrosis, the different parts of the uterus that can have fibrous, healing or whatever. So I don't know whether it's inside the uterus, because I think last time when we were talking about having cleaning of the uterus after a miscarriage or all that, if it heals with scarring, that is, fibrous tissue that has formed inside, sometimes it can inhibit pregnancy. So we might have to remove those adhesions. I call it adhesions or Asherman syndrome. Maybe there is a scarring somewhere else that's attaching to the uterus. The treatment is to try and remove that attachment. But if it's about fibroids, uterine fibroids, fibroids themselves, we have those options. Either we give medication, but the medication really just push the dates of the surgery, change in diet and exercise, and then of course the embolization, which we prefer to do also on particular patients to just reduce the estrogen flow to the uterus. That's the alternative.
All right. Thank you for bringing the guest in studio. I just would like to add to her statement about vegetables that Kenya is blessed a lot. This person is from Liberia.
Yes.
And they say, well, we don't have such, and we find them when you find them, you must pay a lot. Vegetables are good for our health, and I'm so glad to be here, and I am enjoying them. I wish I could trade places with food. Oh, thank you. You didn't give us a name,
blessed.
but thank you, a librarian listening to us. We thank God for you. All right. All right, that's okay. I'll be getting back to that. It's a bit lengthy and I need to sort of break it down. So let's see this. Doctors don't seem to discuss this. Okay, is this part of this? Probably they're talking about, I'm not sure. Let me just read it as it is. Doctors don't seem to discuss this much, and many women, me included, going through this period have really a difficult time, as we don't know whether we're really sick or... Okay, so they're asking, would you please tell us about menopause? Because many women, her included, going through this period have a really difficult time, as they don't know whether they are really sick or it's menopause symptoms. How do you distinguish?
Oh, menopause is not a disease. It's just a stage in life. Okay. It's not an easy time. It's very emotionally draining, very physically draining. And this is the time when most women are going through a lot of issues. Sometimes, they're at 50, there's issues with family, maybe there is money issues, and then there is menopause. And then there's anxiety, there's anger, there's your relationship with other people at this point becomes a bit haywire because you get angry very fast because your hormones are all over, and it's understandable. And all women will go through menopause, all of us,
okay,
at some point. So it's not a disease. It's like converting, like in puberty is also a conversion. Yeah. And as you can see, even during puberty, when girls and boys are changing into men and women, they also go through quite a bit. Right. So it's just that transition. So unfortunately, sometimes some people experience very severe conditions during this time. There is a lot of what the most common is flashes. They get flashes. You just feel this heat coming through from the legs, from the back going to the neck, and you just upset. It makes you anxious. You're sweating in front of people and they don't understand why you're sweating. And they ask, are you okay? And you don't want to be asked. So be careful how we talk to our patient, women at a certain age. There's also a dryness of every part of the body, including down there, and it becomes very difficult to have interactions. Sometimes it's painful, sometimes there's itchiness, which is quite irritating. So all these things are happening to your body, and it's affecting also your mental health. So for these patients who feel like it's really too much, it would be good for us to come in. Sometimes you're able to replace some of those hormones that are giving you severe irritation. And this is lack of estrogen. Now this is when you need you need that estrogen. You need it. It's going away. You're even growing hair places you don't want it. So yeah, sometimes you can, if it's very severe, there's a scale we use. Maybe I'll share it with you. You can send it to people who are going through menopause. There's a thing you can feel and say, oh, this is very severe menopause. I can go to a doctor and get seen. We can also treat the dryness. We can try and but it does not take too long. Eventually your body normalizes. So that's a beautiful thing.
I was actually going to ask, how long does the menopause stage last for?
The stage
is there a number?
There is no particular. Every person is different.
Okay.
Yeah. So and it takes several stages, because there's that one where you're pre-menopausal. Pre is when you're right about to get to menopause, and this is where you have these changes. It can even last a year. So by the time we even say you're in menopause, you've not had your period. It's easier to say when you don't have your period up to 1 year of not having your period. That's when you say, okay, you have gone into menopause. But in between, every person has their own timing. But eventually it ends. It gets better.
Okay. I was just hoping you would tell us
a certain time
between 10 to 5 years or something like that.
It is a whole transition, so it can take even 1 year, some people 2, but rarely does it go beyond 3 to 5 years. But the severe cases we can try and manage. We don't try, we do manage.
All right.
Yes.
Okay. Now, this one says, okay, I would want to encourage fellow women that could be depressed because of bad news of fibroids. I had suffered them for about 15 years, and the bad thing is that when I went to hospital, all the doctors I used to see then would prescribe some painkillers and ask me to try conceive. They were bleeding, and the bleeding became heavier and heavier, too much pain, on and on. I'm trying to get to the hooray moment of this. And she says, I was told I was referred to a certain gyna. He gave me hope, and in May that year, he was able to do a myomectomy, and now I am blessed with 3 children, all through cesarean section, even through even though it's still recurring. But I thank God, and God bless you, Dr. Karen, for informing women, because there's a lot of misinformation and myths out there. This is Lynn, tuned in from K-South.
Thank you.
Beautiful.
Thank you.
Thank you.
There is hope. There is hope.
A lot of it.
Yes, there is hope. Don't be afraid to see a gyna.
Yeah.
And there are people who, I feel like we need to talk about some people being very insensitive about how they talk to the ladies.
Please.
Yes, especially the one. So it's very important for everybody around to be very nice to everybody around you, because women go through a lot. Sometimes even in my office, I have to deal with social issues. They've come because they don't have a gynecology issue, but because somebody said something about them, so, or maybe their partners said something about them, or did something against them, or did something somewhere. So fibroids is a big deal and can happen to anybody. So you're not alone as a patient. You're not alone. Many women are going through the same thing. But those people who see women who have big tummies and say, are you pregnant right now? Tell us, congratulate. I know people who have good intentions, but these good intentions can be very, very, you can really affect people, and especially women who are going through fertility issues, fibroid issue, uterine issue, any issue, because they can appear bloated. They can appear like they are pregnant while they wish they were pregnant. They are not. So we can avoid really, unless they tell you they're pregnant, don't ask them, or don't create feelings within them. Because this really hurts a lot of women. And the stress, as I said, stress and cortisol and all these conditions, other conditions come up. So be kind.
Please.
Be
kind. Okay. Hi, Sharon. Say hello to your guest. Hi, my guest.
Hi, Sharon.
This is interesting. They say she sounds very young, yet very knowledgeable and experienced. Amani Sauti. Well, she has a good voice, and she's young, and she's experienced, and she's knowledgeable. Thank you, Dr. Karen.
Thank you.
We thank God for you. Okay, this one says, I'm really learning on today's topic, especially. Okay, I usually have painful periods that I have to take painkillers for me to function normally. One time a gyna told me to use family planning to help me ease, but it helped on pain but gave me serious hormonal imbalance. My question is, how do I go about it? Because I feel like I'm getting tired of the medication.
Okay. I would advise is to, if you're able to go back, it's important to have a communication with your doctor, because sometimes we know what you're going through, and we understand the kind of things and the medication that we could be giving you can actually stay for a long time. And there's also pill burden. You don't want to be taking a pill every day, yet maybe something else is happening. You have side effects that are affecting you. There are many options. Always remember, there's options to every disease that we manage, or any condition that anybody is going through. So if there is an issue with the medication, we can actually change it or remove it or review and see whether there's anything else that we are not managing the right way. So keep an actual communication with your gynae, because the gynae knows where they started with you and they know where they're heading with you. So it would be good to just have that conversation. taking pills all the time obviously is going to cause a bit of stress, and the side effects can increase. So if those side effects are increasing, then we might remove the medication and change to something else or give it a break.
Okay.
Yeah.
All right. Okay. Thank you. Now, this one says, thank you for the topic. I have fibroids and the scan showed they are 2 centimeters, but I feel sometimes have lower abdominal pains, just straight line after down there. It goes and comes, and I have checked also on my kidneys, but they are okay. And I have also scanned for cervical cancer, but I think she's saying it's not there. Does diet trigger? I have checked UTIs many times, nothing. Please help, because I need to find out what is causing this pain, and sometimes I feel like I have chills since I found out I have a fibroid 6 months ago. I will check again in December to see how long they have reached so far.
That's good. At least we found that there's a fibroid, which is 2 centimeters. 2 centimeters might not necessarily even be the cause of the pain. We can investigate further. Endometriosis can also cause pain in the abdomen. It can be an infection, although an infection would have been found also on the scan. It can be anything. So it might not be necessarily that fibroid. Okay. The 2 centimeters usually are very... should I say innocent, but blamed for a lot of things, unless it's inside the inner layer of the uterus. That can cause bleeding, So if there's no increase in your period, there's no change in any other thing, it might not be the problem. So I would advise that she does review. I know the scan will still be done, it's still important, but to be reviewed properly and see whether there's another thing that could be causing. And the pelvic pain might not even be coming from the uterus. If it's pelvic pain or down there, it can be coming from the bladder, it can be coming from the gut, it can be coming from anywhere. Yeah. Okay. Yeah. And sometimes people who have pain for a long time, we do laparoscopy to check whether there's something else, especially the endometriosis. Okay. Yeah.
And she says she has chills every time she remembers she has fibroids.
Yeah, I'm not sure whether it's chills for cold or
I feel like it's chills
or
for
worry, anxiety.
That's what I feel like, yeah.
Yeah, I don't think she okay. The 2 centimeter one is small. Rarely do we go for surgery for 2 centimeter fibroids unless they are inside the inner layer of the uterus, which again, that one can be removed through hysteroscopy. The simple one, the one we can do after within 24 hours, you're back home, you know? Yeah, so I would encourage her not to be worried. Let her have conversation with her gynae. Let's just tell them how you're feeling. Yeah. We listen, by the way. Part of our work is to listen, because women will give us stories which are good and interesting, but also we have to treat the organic problem. Yeah. Okay.
All right. This one says, a friend of mine is suffering from this, and during her last she says thyroid ultrasound, there's something like that. Thyroid,
yeah, ultrasound.
Okay.
Yes.
She was told that they are multiplying and they are small in size, and she's not under any medication right now. What would you tell her?
Okay, the thyroid is a different organ. It's found at the base of the neck. It's the one most people, if you've ever heard of something called goiter, is that thing that grows at the base of the neck. That's called a goiter, or just a big thyroid. And there are people who develop it because of different reasons, which is it's for surgeons, but we all understand them. So if you have nodules, probably it's nodules that she's talking about, they need to be followed up by a surgeon. There are times they can remove, depending on how that thyroid is functioning, and because of the aesthetic look. If they don't want that thing showing, nobody wants to have something at the base of the neck. So sometimes even because of that, they can be able to do surgery and remove them. Yeah, so if she had that diagnosis, I don't know what they were told, what the thyroid function was, because also the functionality of that thyroid must show on lab tests, depending on what the lab tests say, what the thyroid said exactly, what is there, whether it's nodules or whatever, they can be managed. There's treatment for that. To look for a surgeon, a general surgeon.
Okay. I have a question concerning my periods. I am a lactating mother, and ever since delivery, I have not received my periods for 7 months. I only got some slight spotting the past 2 weeks, but just for a day. Could there be any issue?
Is she a first-time mother? She's not indicated.
She didn't, yeah.
Okay. So, anyone who's lactating, that lactating on its own will tell your brain to stop some hormones from allowing you to get pregnant.
Okay.
You get me?
Yes.
Because you don't want to get pregnant while you have a small baby. God has very interesting ways of working. And thank God we can discover these things through science and say that this happens. So if you are lactating and you're consistently lactating, breastfeeding, it's a form of even a contraceptive because it protects you from conceiving. And how does it do this? It has hormones. There's a hormone. Once you breastfeed, it takes it to the brain, and the brain tells the pituitary, all these other levels, like the pituitary gland, and then of course now to the ovary, and say, stop. Don't produce another egg. Don't produce estrogen. Don't produce progesterone, so that you don't form a baby. And of course, if you don't have these hormones, then you will not have a period.
Yeah.
That is how you have amenorrhea, what we call lactational amenorrhea.
Okay.
And it can be there as long as you're breastfeeding well. Within 6 months, you'll have lactational amenorrhea, which is also a very good way of preventing pregnancy.
Okay.
So your baby is preventing another baby from being formed. But there are people who they go to work. So you'll find like if they have breaks during the day, then they are most likely to get their periods earlier than the 6 months.
Okay.
Yeah. It's a good way of preventing pregnancy, but because we cannot say that you breastfeed every 3 hours, every 2 hours for 6 months, we add you another protective hormone. Now the simple progesterone, which is light, it's not as heavy as the others, to protect you from pregnancy during that 6 months.
Okay.
But if you're a mother who knows you can breastfeed like this, it's a good thing up to 6 months. It will stop your period, so it is expected.
Okay.
Yeah, after 6 months your period may come back.
Okay. Right, this one asks, well, I'm not sure if this is in your field. You will tell me.
It's okay.
What causes bowel peristalsis, and how can it be controlled and treated? Is that reproduction really?
It makes sense. Okay, so there is movement. The bowel has a way it moves. Yeah, it moves like a wave, to allow things to pass through, and then you have normal emptying. The way you eat, your food should pass. So their work is to just push. That's now the peristalsis. Okay. So that when it's happening, it's a good thing. If you have any blockage, let's say there's something has blocked somewhere along the way, your peristalsis will increase because that gut is trying to push that thing as much as it can, but it's not working. So that's when you can have increased, or you can even have eventually after it has tried so much, it stops. Okay, so now that is now called paralytic ileus. There are people who have surgery. And most so, I think maybe they're asking because they probably had surgery and it was a gynecological surgery, and then there was a problem with the movement of the bowel because of the medication maybe we are giving them, the painkillers we are giving. Sometimes that can reduce or increase depending. So there are people who have constipation because of that. So yeah, it's general surgery, but because sometimes you experience it for patients who have any surgery, we know about it. So we give medication to clear out the bowel, which at least allows the peristalsis to go back to normal.
Okay. All right. My wife is 3 months pregnant. She has been experiencing severe pain on her left side of the belly. The doctor said the fetus is near a vein. Should we be worried?
The baby just takes the position it wants to take. Okay. And we cannot let them know that, here you're pressing on this, you're causing this. Yeah. The only thing is what we can do is we can try and change position to avoid that kind of pain.
Change the
mother's position.
Okay.
Yes, the baby
Okay.
cannot change.
Okay.
The only way is if you can change the mother's position, or whatever position she's able to take at the moment, that reduces her discomfort. That would be the best thing.
Okay.
So that at least even when you change, the baby can move. You know, if you lie on your left side, the baby moves off any important blood vessels. We prefer women who can sleep. We tell them to sleep on the left side, mostly because there is a big blood vessel. If you sleep flat, especially if your baby is more than 20 weeks, or if you sleep on the right side, you're likely to compress on it, and you can easily faint, or you can even lose your breath, you know. So if you feel that at all, always lie on the left side, but also make sure to see a gyna in case you have those symptoms, because ideally, when you're at home, we don't always tell you to sleep on the right or the left. But if you really have to, you're losing your breath and that, we need to see you in case there's another reason. Yeah, but that can really help. There are people who prefer sitting or standing. Whichever position that helps you relieve that discomfort, then do it more often.
Okay.
Yeah.
Right. Thank you. If you just joined us, this is Hope FM, where you listen and live. We are with me, rather, is Dr. Karen, and we're getting to answer your questions. She is an obs gyna. Obs
Obs-gyn resident.
Yeah.
Yes, resident.
Yes, resident. All right. This is very informative. I have a question on a different topic, though. I got to know that I have an inverted uterus years after I had my first child, and I just wanted to know what implications this has on subsequent pregnancies.
Okay. There's different words we use for the position of the uterus. If we're talking about there's anteverted, and there's retroverted and anteverted. That is the position of usually the uterus lies down, like it's like bending over to the front side. If you look at the uterus from the sideways, it's always at the bending over to the front side. So that's the expected, because that's good. You're able to maintain something inside. You know, if it's straight like this, then you're directly over the cervix. But when it's bent, then you can keep your pregnancy. It grows the right way. Retroverted can cause a lot of pain. That is when now it's bending backwards. It can cause a lot of pain and discomfort, but does not necessarily change much about pregnancy and how you are. It's not a disease to change you or do surgery to turn it around, unless it's very severe case.
Okay.
Then if she's really talking about inverted, if you've delivered and your uterus was the uterus, when you deliver, we remove the placenta after that. Then we have the uterus that can follow the placenta in a way that it comes out. It's a very rare condition.
Okay.
Yes, so that's why I talked about all kinds, because I don't know that it's that one she's talking about, where it can follow the placenta.
Okay.
Very rare cases, because when you remove the placenta, there's a way we remove in a way that it will not, it turns on itself and comes outside. It's an emergency.
Okay.
Because you don't want the cervix to close it inside out.
Okay.
So we have to return it immediately.
Okay.
Immediately when we can, or even when it has stayed, we have to go to theater and return it, because obviously it cannot stay turned outwards. Because the cervix, when it's open, the uterus can pass through it. Yes, it's a very rare case, but they do happen.
Okay.
They do happen, and there are ways we manage that. So if she's afraid to get pregnant, let her just get pregnant again. It's okay. It's good for us to know, so that we are ready for it immediately.
Okay. Still on, a question that has been asked again and again, menopause. Is there a time and age where it starts? Like a specific? Or it depends? It
depends. We should talk about menopause. It's a very interesting topic.
Right.
And I think we don't talk about it much. So we say that from 40 years onwards, we expect your menopause to start at any point in time. Okay. Depends on the time you started your first period, your genetics. We cannot tell you that yours will start at 45 or at 50 but any time from 40, we know for sure that your egg reserve has reduced.
Okay.
Anytime from there, you're likely to develop the symptoms. They can be there. You can, You can have the hot flashes and all that before you get into full, like we say, for sure you've reached menopause. So there isn't really a time. Everyone is an individual. Everyone takes their own timing for their menopause.
Okay. All right. I was recently diagnosed with PCOS, and I feel like my doctor overlooked some diagnoses I saw on my scan. I saw that it was written I have features of posterior myometrical and adenomyoma measuring 15 and 12 millimeters. What does this mean?
Okay, it would be good to always, when you see something, don't go away without asking. It's okay to ask, because sometimes even when I see 1 centimeter fibroid, I will let you know. It is important for me to let you know, but I don't want to scare you, so that you're like now having chills after knowing you have a 1 centimeter fibroid. I will just let you know that it is there, but nothing to worry about, to continue. So if you do have, it's probably very small, didn't have any symptoms, then there might not be need for any work to be done on you. But of course the PCOS takes the predominance because it is the one that had symptoms. Sometimes we find things that you didn't come complaining about. We can find that anything. We can find incidental finding of even a fibroid that you didn't come. You came with something maybe different. A liver problem, but found 1 centimeter fibroid. So the liver problem will take predominance. So it's not because that we ignored it, but it probably didn't need immediate management. But it's good to ask, does this need any immediate management? Is this going to affect my life? What can I do? Yes. So that's what I would suggest for her. Probably it was very small in millimeters and didn't cause any harm.
All right. My friend had fibroids that were not painful and was not a bother, but they were growing bigger. But towards the end of 2020, she was diagnosed with various symptoms. In January, she opted for them to be removed, but upon removal, the doctor upon the removal, the surgery took place. They discovered she had uterine cancer. The family later suggested to have her taken to India. Upon arrival, the PET scan was done and discovered that the fibroids were not removed. And then again it was discovered it's ovarian cancer. All right. So she's wondering what would have caused this. The tumor had grown to 1961. I don't know what that is, millimeters or what, I don't know.
Even I would, but so as I said, fibroids, only 1%, very rare, can develop into a cancer. If we do remove your fibroids and you're below 35 years, most likely when we take it to histology and check, most of the time is a simple fibroid. But if you're above 35 years of age, sometimes we do not know. At that point, you're at an age where you are at more risk of it converting. And we don't know who will convert or not. But it's very rare. So we always send every sample we remove from your body into the lab. By the way, that's information that all of you should know. Anything we remove in the body goes to the lab most of the time. For us to just confirm it is just even if it looked like a fibroid, just a fibroid, we say, okay, fine, that was just a fibroid, we removed it. But assuming that she went in for surgery, they saw that this did not look like a normal fibroid, and that's how they ended up sending. I'm just assuming that's what could have happened. It means they couldn't have removed further because they don't know to what extent this change has been and whether they should continue removing it or remove the whole uterus. But you signed a consent for just fibroids being removed. So we cannot remove the uterus unless it is going to save your life. So they probably removed that sample, and then it was discovered that it had cancer. And then with further investigation, that